Well, we hugely value the contribution of doctors. We recognise there have been significant pressures from the pandemic, but also from an older population and the pressures the NHS has been facing. And today's offer, 10.3% for some doctors in training, over £3,000 up to almost £5,000 for doctors in training. Some consultants getting a pay rise of over £7,000 is a fair offer, a fair settlement. It reflects the hugely important work that doctors do, and it's an opportunity now for the NHS to move forward in exactly the way we have with the Agenda for Change staff, where we have reached a settlement. We negotiated with the NHS Staff Council. We've now set out a final settlement in terms of doctors, and it's an opportunity now for the NHS to move forward. Well, this is a fair and final settlement. An increase for some doctors in training of as much as 10.3% reflects the huge value of the work that they do. And it's now time that we move forward. And nurses, paramedics, porters, many others within the NHS have reached agreement with the government. This now reflects the biggest increase for doctors in training of any public sector workers. It's an opportunity to move forward. Of course, my door's open to discuss with the BMA other issues in terms of the quality of working conditions with the NHS and how we best support doctors in training. But an increase where all doctors in training will get between £3,000 and almost £5,000 more. Some consultants will get over £7,000 in terms of pay rise, is the opportunity now to have that final settlement and to move forward and focus on cutting the waiting lists and getting treatment quicker to patients.